Dear ANA community, what do you mean by Dosha Sravana? What do you mean by Asrik Sravana? What is the relation between Dosha Asrik Sravana in excess will be responsible for the manifestation of Vatavyadhi is the topic of discussion of this particular video. Dear community, press the thumbs up and press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Don't forget to spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Now coming to the description of Dosha Asrik Sravana and Vatavyadhi. When you look into the description of the Charaka Samhita, it is being mentioned that Ruksha Shitalpalabghanna Vyavayati Prajagare Vishama Dupachara Cha Doshasrik Sravanadati Langhana Plavanatyadva Vyayamati Cheshtitedhi Dhatunam Sanshaya Chinta Shokarogati Karshanat Dukha Shayasanat Krodha Diva Swapnat Bhayadapi Vega Sandharanadamat Abhighata Dabhojanat Marmakhatat Gajoshtrashva Shigrayana Patamsanat. So these are the different Nidana. They are responsible for the manifestation of Vatavyadhi. In this particular video, we are going to discuss the relation between Dosha Asrik Sravana, Ati Dosha Sravana and Ati Asrik Sravana in the manifestation of Vatavyadhi we are going to discuss. What is the word meaning of Ati Dosha Sravana? In the sense, the excess elimination of the dosha, or what we can say the pathogen, which is responsible for the manifestation of either Vataja Vikara or Pittaja Vikara or Kafaja Vikara. We are going to eliminate from the body. In case of the Vataja Vikaras, we are going to administer Basti. In case of Pitta dominant diseases, we are going to give the Virechana. In case of Kapha dominant diseases, we are going to give Vamana, or what we can say the emesis, therapeutic emesis as such. If that is being given in excess, then that will be responsible for the manifestation of Vatavyadhi. Whereas Asrik Sravana, the term Asrik is another synonym of Rakta. That is, when you are giving Rakta Mokshana, or what we can say the bloodletting therapy in excess, again, so that will be the reason for the manifestation of Vatavyadhi. And when you think about the term Vatavyadhi, any kind of the discomfort observed in any part of the body from head to toe, which is due to the abnormal increase of either one, two, or more gunas, or all the gunas, wherein we are going to have the affliction of Sira and Kandara in the body. So we are going to expect what you say that the manifestation of Vatavyadhi. Now we are going to decode the word Dosha Sravana and Asrik Sravana in this particular video. When you think about the Dosha Sravana as such, in the sense, so here it is actually the treatment part. So when you think about the pathogens, usually, so that will be entering from the either from the mouth. From there, it will be entering into the stomach or small intestine, large intestine. From there, it will be entering into the blood vessel. From there, it will be, that is what we can say the intravascular compartment. From there, it will be entering into the tissues, that is interstitial compartment at the capillary level. From there, it will be entering into the cells in the interstitial space. This is what is considered to be the mechanism of the manifestation of a disease. When you think about the Dosha Sravana as such, so we are going to make sure that to move the pathogens, what we can say, in this particular vacation, kapha manifesting pathogens, or that is the from the intracellular compartment, it will be entering into the interstitial compartment. From there, it will be entering into the intravascular compartment. From there, it will be entering into the stomach. Or if the pathogens responsible for the kapha dominant diseases, if they are present in the interstitial compartment, then that will be entering into the intravascular compartment. From there, it will be entering into the stomach. Or if the pathogens are present in the blood vessels, from there it will be entering into the stomach. From the stomach, it will be eliminated via oral route in the form of the emesis, or what we can say the Vamana. This is what is considered to be the actually Dosha Sravana as such. When you think about the pitta dominant diseases as such, wherein the pathogens, if they are present in the cells, from there it will be entering into the interstitial compartment, from there it will be entering into the blood vessels, from there it will be entering into the lower end of the stomach, or otherwise that may enter into the small intestine, or otherwise if the pathogens are being present in the interstitial compartment, from there it will be entering into the intravascular compartment, or from there it will be entering into the lower end of the stomach, or otherwise into the small intestine, or otherwise if the pathogens which are responsible for the pitta dominant diseases, if they are present in the intravascular compartment, from there it will be entering into the lower end of the stomach, or otherwise it may enter into the small intestine. From there it will be eliminated via purgation, what we can say the anal route, or otherwise what we can say the Virechana. Or if the pathogens are being present, which are responsible for the Vata dominant diseases, if they are present in the cells, that will be entering into the interstitial compartment. From there, it will be entering into the intravascular compartment. From there, it will be entering into the large intestine. Or if the pathogens of Vata dominant disease, if they are present in the interstitial compartment, from there it will be entering into the intravascular compartment. From there, it will be entering into the large intestine. Or otherwise, if the pathogens of Vata dominant diseases, if they are present in the intravascular compartment, that will be entering into the large intestine. From there, we are going to give the medicines through the rectal route, and we are going to eliminate these pathogens through the anal route itself. So that means wherein the administration of the medicine will be through the anus, and elimination of the pathogens will be happening through the anus itself. This is what we can say the Dosha Sravana as such. And when you think about the Asrik Sravana, wherein we are going to eliminate the blood. For example, here the person may be having the skin disease in the lower lip. So we are going to give the Rakta Mokshana in the lower limb, or the affected part where skin lesions are being present. Then we are going to eliminate the blood in the lower limb itself. So this will be responsible for the transport of the pathogens of the affected part into the intravascular compartment. From there, the pathogens from the cells will be entering into the interstitial compartment. From there, it will be entering into the intravascular compartment. From there, that will be eliminated to the body through the exterior. In cases of the Rakta Mokshana, or what we can see, the Asrik Sravana. And when you think about the Ati Dosha Sravana and Ati Asrik Sravana, the amount of the pathogens so eliminated, that will be there, but plus even more amount of the nutrients in the form of either fluid or the water or electrolytes, that will be eliminated. So here there will be the what we can say the more amount of these the components of the body will be eliminated either through the oral route during Vamana procedure, or through the rectal route during Virechana or Basti procedure, or the elimination of the excessive fluid including electrolytes, that may happen through the bloodletting, whenever if you are giving the more amount of the bloodletting treatment as such. So that will be responsible for the what we can say the uh, hypovolemia as such. So here we have seen the three main things that may happen in cases of the Ati Dosha Sravana. So that is excessive fluid loss that may happen from the alimentary canal. So in the during the Vamana and Virechana and Basti, plus there may be more amount of the nutrient loss may happen. Initially that will be associated with carbohydrate loss, that will be followed by fat loss. At last the person may have the protein loss. Along with that, the person may have even the electrolyte loss also. Sodium, potassium, and calcium loss may be observed from the body. Or otherwise, when you think about the Asrik Sravana, what happens will be, in this particular example, excess blood loss may happen from the lower limb, which in turn are responsible for the reduced intravascular compartment. So which is being supplemented by the fluid from the cells as well as interstitial tissues. Thus, there will be reduced interstitial compartment as well as reduced intracellular compartment may happen, which is responsible for this kind of the phenomena as such. Here, more amount of the fluid that will be eliminated from the cells, interstitial tissues, as well as from the blood vessels into the either stomach or small intestine or large intestine. Or otherwise, when you think about the Asrik Sravana, so that more amount of the fluid, including nutrients and electrolytes, that will be eliminated from the cells, from the interstitial tissues, or from the capillaries through the to the exterior through the blood vessels. So in the sense, so when you think about the in terms of the Ayurvedic understanding, initially we are going to expect reduced fluid content. In the sense, more amount of the fluid will be transferred from these into the cells. In the sense, here we are going to expect more amount of the Shoshana karma. So in the sense, there will be the increase of Ruksha guna that is going to take place in the body. When you think about the next aspect, that is reduced nutrient. So that means there will be the sequential loss of carbohydrate, fat and proteins, along with that water and electrolytes that is going to take place, which in turn are responsible for the Langhana effect. In the sense, there will be increase of Laguguna is going to take place in the body. Plus, which is associated with reduced electrolytes also, which is in turn may be responsible for the Suptata, etc., which may be the responsible for the increase of the Laghu, Rukshaguna, etc. When you think about the Asrik Sravana as such, we are going to expect increased Shoshana in the interstitial compartment as well as intracellular compartment, plus the affected part where we are going to do the Rakta Mokshana. In the sense, there will be increase of the Rukshaguna that is going to take place in the area where we are going to do Ati Asrik Sravana. In the sense, all these are considered to be responsible for the increase of Vata Dosha vitiation. In case of Ati Dosha Sravana, in the sense, this particular Vata Dosha vitiation specifically may be seen in the alimentary canal, which will be followed by the Vata Dosha vitiation, maybe in the intravascular compartment or interstitial compartment or intracellular compartment. In cases of Ati Asrik Sravana, so the Vata Dosha vitiation in the alimentary canal may not be there, but there will be Vata Dosha vitiation may be present in the intravascular compartment, interstitial compartment, as well as in the intracellular compartment. To sum up, the term Dosha Sravana and Asrik Sravana is considered to be one type of the another Vatavyadhi manifesting Nidana. The term Dosha Sravana refers to the Samshodhana therapy as such. In a sense, Vamana, Virechana, Basti and Nasya. Whereas the term Asrik Sravana refers to Rakta Mokshana, or what we can say the bloodletting therapy. So, which is may be considered to be the other external factors such as Sanghata Bala Pravritta Vikara, or what we can say the bleeding happens by other means other than therapeutic bloodletting. For example, in case of the sports injury or road traffic accident, etc. Depending upon the impact of Dosha Sravana and Asrik Sravana, the person may show the Vata dominant Lakshana in the body, wherein we are going to expect the effect of that particular therapy as such. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion mention in the comment box below, and what is the one video you'd like to hear in the coming days in this particular channel, mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget, press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.